Okay, welcome back friends. Welcome back in another antibacterial video lecture series. So in this video lecture we will going to discuss about super infection. Okay, so antimicrobial agent, especially broad spectrum antibiotic. I hope you know about what is broad spectrum antibiotic. Broad spectrum antibiotic means those kind of antibiotics who have a very broad coverage. That means they can infect or they can show their effect towards a wide range of microorganisms. Okay, so now may not only exert their adverse effect on pathogen but also on the indigenous normal microflora. So it is obvious because it is a broad spectrum antibiotic. That means they will not specific for the pathogen but also for some microflora. Now the question is, what is microflora? So microflora is nothing but the normal residents of our body. Okay, so they mainly resides in the skin, digestive tract, respiratory tract, urogenital tract, but you may not find them or you must not find them in your delicate organs such as your brain, your heart, your CNS. Okay, if there is a presence of microorganism, then they will be no longer considered as a normal microflora. Instead they will be considered as a transient disease causing microflora. Okay, now this microflora do not cause usually any problem whenever they are living in skin, digestive and respiratory and urogenital tract, and by living here they also prevent the colonization of the transient pathogenic microorganisms. Okay, so under such circumstances, if you use a antimicrobial agent which is a broad spectrum antibiotic type antimicrobial agent, so those normal microflora will be disturbed. Okay, and as a result there will be a few gap, because first of all remember it very carefully that in skin, digestive and respiratory tract they remain together, just like they colonize together. Okay, so now as you have used antimicrobial agent of broad spectrum coverage, so you are simply disturbing them. As a result there will be few gap in the area. Okay, now there can be few microorganisms, for example yeast, candida and other kind of bacteria who are not susceptible to the antimicrobial agent that we have used. Although we are using a broad spectrum antibiotic, but there can be a chance that there are some bacteria who are not susceptible to that antimicrobial agent. Okay, so those kind of microorganisms, there will be a high probability that they will occupy those unoccupied areas. Okay, and starts multiplication rapidly. So this kind of invasion by replacement of the normal microflora due to the use of broad spectrum antibiotic are known as superinfection. Okay, so again I am telling you that whenever you are using a broad spectrum antibiotic as a antimicrobial agent, the broad spectrum antibiotic will not only destroy your pathogenic microorganism that is causing the particular infection, but it will also disturb the normal microflora that is present in skin, digestive tract, respiratory tract, urogenital tract. So under such circumstances, the microorganisms who are not susceptible to that antimicrobial agent you have used, they will start occupying those unoccupied portion after invasion, and then they will start multiplying rapidly. So this kind of infection are known as superinfection. Okay, so now this superinfection is a very dangerous thing for us, because there are only few antibiotics that can fight against this kind of superinfections. Okay, so we have to use antibiotics very carefully and with proper prevention and proper caution. Okay, so although if you use short time penicillin, then it will not cause any kind of severe damage to the normal microflora. okay, but if you use oral ampicillin, then it will facilitate the growth of the toxin producing Clostridia, okay. And also long term use of penicillin and aminoglycoside will facilitate the disruption of the normal microflora by promoting the colonization of the gut with resistant gram negative bacteria and fungi such as candida, okay. So under such circumstances, what will be the cure? So you can use yogurt which will contain lactobacilli, and I want to told you that lactobacilli is also a important normal microflora, especially in our intestine part. So under such circumstances, they will again colonize and cure the entire condition, okay. Or a preparation called Lactinex may also be used, which contain normal microflora, so can be given to counteract the effect of the antibiotic, okay. So that is the concept of super infection. So again repeat the entire thing. Antimicrobial agent, which is mainly broad spectrum antibiotic, do not show their harsh activity towards microorganism, but also it also show their harsh activity towards the normal microflora of our body, and as a result they become disturbed, okay. And those kind of unoccupied region created due to the antimicrobial agents action towards normal microflora will be occupied by other microorganisms who are not susceptible to that broad spectrum antibiotics, okay. And as a result they can easily grow there and multiply in a rapid way, and as a result there will be formation of colony, or they will colonize there very rapidly, okay, which will facilitate the infection called super infection. So super infection is very dangerous because there are only small kind of antibiotics as present or available who are susceptible to this kind of super infection. So under such circumstances, the only prevention is you have to take antibiotic with lot of precautions, and not only that, you have to take antibiotic only after and according to what your doctor prescribes, okay. So we can use penicillin within for short time, so it will not cause any kind of severe damage in the normal flora. We cannot use oral ampicillin because oral ampicillin facilitates the overgrowth of the toxin producing Clostridia, and long time penicillin and aminoglycoside can also be avoided to use because it will abolish natural microflora and allow colonization of the gut with resistant negative bacteria and fungi such as candida. So to counter this entire situation, we can use live culture of yogurt or preparation of Lactinex. This Lactinex contain microflora, okay. So that is the idea of super infection, okay. So again, the antimicrobial agent or broad spectrum antibiotic which causes the disturbance in the normal microflora and the unoccupied region created by the normal microflora due to those kind of antimicrobial agent will be filled up by other microorganisms which may be harmful in most of the cases, and such kind of infection will be considered as a super infection, and it is very difficult to treat because only few antibiotics available who are susceptible to such kind of disease, okay. So that's all for today, guys. So today we have discussed about super infection, okay. So I hope this video will be helpful to you, and thank you for listening to this class.